All right, guys, welcome back to DragBoss Garage with the boss at Izzy. So here's what's going to happen. So I ended up cutting my finger. We'll show you here with this. I just sharpened it up, new blade, and I was cutting a pill for Zeus, one of these things for flea and tick. It's big. So I pushed down and it popped and went through, and I tried to cut it in a quarter, and then the thing popped through and went over and cut my finger wide open. Now normally I wouldn't mess around with this. Problem is it's been probably 6-7 hours and it keeps bleeding. So that's why you need sutures. One, to approximate the tissue, right? So it heals better without less scar formation. And two, for hemostasis, or to stop the blood. Now I could do this myself. It's just hard to tie it when it's your own hand. You know, it's my non-dominant hand, my ring finger. So you can see here, you can see the big flap. Yeah, you see it?
Oh.
Big flap open. So it needs a couple sutures in it. So Izzy's gonna suture it. She's never sutured before. And I cleaned up stuff with alcohol that burns like crazy. And you can see it pouring out blood.
Ew.
And that's another reason. It won't stop bleeding, you gotta suture it. So the first thing we're gonna do is we're gonna inject this thing. So you never injected anybody before, but I'm gonna show you how to do it. What? Relax.
I would hate if that were in me.
So you're gonna take the needle. Don't be fooling around now. I don't want to get jabbed. And what you're gonna do is I'm gonna have you're gonna stick the needle right in here, where that's right in this area.
Where it's bleeding?
Right on the edge. Let me show you.
How do I hold it? Like this?
Like this.
Can you just do it?
I'll do a little bit. What?
Nothing.
And sometimes with like little kids, I'll just kind of put it in here and just wash it up a little bit.
Does that burn?
Yeah, it hurts too. But you can't be a wimp, right? What would you do if you're survival? You better do this. My dad did this to my forehead without any anesthetic. That's why there's a big dent here. So this is plain lidocaine. Now you use 2%. I like 2%. They make 1%, but I think the 2% works better. So the problem with the other type of lidocaine, which is with epinephrine, that's great around the face, around the arms and legs. But if you put it, the acronym is, you don't put it in penis, nose, fingers, toes. So that's where you don't, but see how it keeps bleeding like crazy? I want you to put it in.
Dad, I can't.
Don't tell me you can't,
How do
okay?
I hold it like this?
Like this. See how I do it? Yeah. So put a little right up in this area. Now careful, I want you to jab it into the tissue. Just do it. I can take it. He's going a little bit further. Yeah. Good. Hold it there. Now what you do is you pull back on the syringe. You're not ready to do all that. We're okay. We're not in artery or vein. Just squeeze. Inject it. Good. Good. Yeah, good. Okay.
I'm glad to see
Now watch the needle, please. I don't want to get jabbed, so let me have that. Now, you're going to take this,
Oh, yeah.
and this is the needle holder. So it goes like this. Okay? Take it in your hand. You hold it like this.
Yeah, I know.
Oh yeah, wise guy. She knows. Okay? So what I want you to do is suture this finger back together.
I don't know how.
Well, I'm going to show you.
Okay.
Give me your hand. It's hard to see because you could have a tourniquet, but I don't have one. Okay. Now what you want to do is you want to release that. Push it. Yeah, easy. You could just take it. You got it. Release it. Good. Take it away. Take it away. Now grab that needle and push it through. We'll give you a little, yep, pull that out. Don't wreck the tip now. Yep, pull it right out. Yeah, good. Yep, pull it all the way out. Keep on that now. Good. Now what you're going to do, let go. Yep. Now you're going to just do a quick little easy knot.
Is that all we needed? It came out.
Yeah. Because I got stuck on the blood. It's hard. See all the blood we're getting, we're losing?
Yo, I don't think you could show that on YouTube.
Huh?
You'll get your video taken down.
No, this is surgery type stuff. They can put it in there. Watch, I'll do it right here. Now you want to be close to the edge of the tissue. See, if you go too close, you'll rip it. It'll rip out of there. So you need a good bite. You bring it up like this, okay? Don't pull your suture through. You want to leave a tail, but you don't want to waste suture. You don't need the whole thing hanging out. You just need a little bit. Good. Now you're going to take that needle in your hand, your left hand, the needle in your left hand. You're going to take this, and you're going to wrap it around twice. No, the thread. Wrap it around no, like this. It's hard to do it with yourself. 1, 2. All right, I'll pull that needle. Be careful. Pull the needle. Now you pull, because I don't need all this thread. Keep pulling. Pull. There. Good. We're getting a big mess here of blood. It's all right. It's my blood.
I don't want the needle from here.
All right. Now you wrap it around again. Take this. Wrap this around that needle twice. Just the body of the needle holder. Yep.
1,
Yep.
2.
Okay. Now grab the thread with this needle holder. Grab it. Good. Now pull this out, the needle driver back. Pull the needle driver back right through that loop. Pull. Good. Perfect. Do it again. Wrap it around that twice. 1, 2. Now grab that thread.
Is that 2?
Yeah. So we're wasting a lot of suture, but that's okay. We never did this before. Yep. Yep. Slide the thread down. Yep. Pull this part. Pull this. Not this, this. This is where you're tying the knot with that in your left hand. Got it?
Okay. I don't want the needle to get me.
It ain't gonna get you.
You're gonna do the same thing?
Yeah. Let me do this to make it a little easier. 1, 2. Good. Now grab that thread. But grab it at the tip, so you're going way deep. If you use the tip, right there. Now pull this hand. Pull this needle. Pull it down. Pull. Good. Do it again. One more and we're good. So this is how you suture yourself in the garage. When you get injured, this is how you do it. 2 times. Grab the tail. Yeah. Now see how it's way down the jaws? You want it at the tip. There. Pull with this hand. Slide your needle. Pull with this hand. Good. Good. Now pull tight. Good. Hang on. There you go. Now get your needle holder back, your needle back in the driver.
There's thread on.
All right. It's hard when you get people that are really bleeding bad. It's hard because the blood gets clotted and then it catches on stuff, the little pieces of blood. Yep. Right in the middle of it. Don't grab the swedge because you'll break it off.
Yeah.
Okay. Now, that's not right. Take your hand out. You can't use it like that, girl.
Oh.
Okay, like this. Now, you can wipe it off. Wipe the finger. Now I want you to put the needle right through here. I'll guide you. Ready? Put your hand on that. You said you want to be a PA, and this is what you got to do. Now undo the needle driver. Yep. Take it right away. Careful now. Yep. Pull that up. Nice. Now don't pull the thread through.
I know.
Keep going. Okay. The shorter the thread, easier. Yep, right there. That's good. Now take the needle off. Needle in your left hand.
And just do the same thing?
Yep. 1, 2, grab this.
It came off.
It's all right. 1, 2, yep. Grab this.
Where is it?
Hang on now, don't.
It's right there.
All right.
And then
Pull this hand, slide the knot down. With this hand, pull that hand. Pull. Good, gentle. You don't want to break this thread. Yep, do it again. So anyways, this is what you learn at DragBoss Garage. Always something interesting. Grab the end of it, yep. Can't see. That's something I say. Yep, perfect. Hold on tight, good. Yep.
yeah, I'm getting pretty good at this.
You've done it. She's getting pretty good at it. Tell the camera. Tell the guys on DBG she's getting pretty good. Yeah, pull the thread down. Yeah, there you go. Good. Now, people say, well, how many knots do you do?
One more time.
Yeah, go ahead. How many knots do you do? You know what? That's a preference. When I did cardiac surgery, I like the number 7, and I would tie 7 knots on something real small. It's just how you do it. You know, 4 is probably enough. I like an odd number. The top one will lock it. What are you doing?
I'm done.
No, I want to do another one. Channel. Grab the thread underneath though. Yep, bring it up here. It's hard when you've never done this. I mean, I've taught so many people to suture, it's not even funny. Plastic surgeons, orthopedic surgeons, anesthesiologists. Good. Yep. And it's funny how I remember teaching them and they're like struggling like crazy, and it's like, I've been doing this for 25 years. Pull it up tight now, you can't cut yet. Always cut with the tips of the scissors up here. Don't cut back here, you'll cut artery. Of course we do. Let's get some alcohol on the subject.
Wait, like hold it like this?
Oh,
Other way?
let me just show you quick. I don't know how many guys are gonna watch this, but if you ever load a needle driver, you always, if you're right-handed, you want it this way, because you're always working the needle this way, like this. If you want to load it left-handed, when I was a scrub tech, just flip the needle around like this, and the left-hand guy goes like this.
Oh.
That's easy. And so some people will sit there and try to take it out and spin it around.
That's dumb.
It's all right, it's just blood. It's our blood. Grab it. Okay. And then we want another one right here. Do you see the cut? No,
Yeah.
up here. Hang on a second, I can't see it. Yeah, right here.
Can you guide me?
Yeah, just push it in. Easy now. Here, you're fighting me. Just let go. Yeah. See, the curve of the needle will guide you. Let it follow its curve. When you try to manhandle it a little bit, it makes it harder. The needle has a curve. Let it do its work. Yeah. And I never put my fingers in here. Never put them in there. I only use the thumb. Right. Get your fingers out of there. You don't need that in there. Good. Only have it like that.
Oh.
That's how a surgeon would do it. Yep.
Second.
A little bit more. Good. I just don't want you to pull this out. We only have a little bit of suture left. We got another one to do. Nice. Yeah. Good. How many 13-year-olds you know suture people's fingers back together?
None.
Lacerations.
Don't move, patient.
All right, all right. Anyway, so this is, I'll put this on the channel, and I'll tell you, I have a lot of things I've sutured that I would love to put on there, and I might put that on the Grumpy PA. I might put this on there too. But this is how it's done. You know, people ask about, oh, how do you get it to go back together? I don't know. Sometimes I can't even tell you how I do it. It just goes, it just works. But you always do, you want to do small bites. You don't want to tighten the tissue when you're tightening up the suture and constrict the tissue, because that causes ischemia and then it doesn't heal well. Nice, gentle. Work with it gentle, man.
What happened?
Think of it as like your own finger. Right here is the end of it.
No, it's like a loop-de-loop.
Huh?
It's a loop-de-loop now.
So pull that little thing, that little tab that's left, pull that up. Pull. Easy, easy. I don't want to tear it through. Do one more on that, baby. Yep. Now the shorter this is, the more length you got. Then you don't have to cut it. And you save suture. That's how you save. Good. Now when you're going to help someone, you want to pull these both up with your needle holder. Yep. When you're in surgery, that's what, gentle. You're pulling out, pull straight up. Up. There. Now I can see it when I'm going to cut. That's what the surgeon's going to tell you. And then we need another one back here, and we're good. Right across here. See it?
So like that? I mean,
Yeah.
like that?
Yeah. Right across this from here to here. From here to here.
So like right there?
Yep. Push it in. Yep. Come up the other side. Let the needle do the work. There it is. Let the needle do the work. See?
Oh.
You got your fingers. I told you not to do that. That's why you pulled it back out. Now you got blood coming out and you can't see. All that does, look, all that does is cause you're holding. You need to hold it. Look how you're holding it down. You want it this way, hon. Okay. Just relax. You got this. What you're doing is you're going
No,
like
I
this.
hate when it closes because then it's so hard to get out.
But you only use your thumb to pop it, so you never use these instruments. If you go in here, your fingers get caught in here, and that's what happens. You pull it back out.
You did that part.
No, you're doing it. Yep.
Just the thumb.
Yeah, I don't even use sometimes. I just push it with my side up. That's okay. Extract the blood. Right there, yep. Yep, now come back up to the other side.
Okay.
No, that's not big enough bite.
Oh.
You're holding it up. Now, see how I can't do it because I've got this hand. See? Now I have my finger there too, so that's okay. But I'm awkward here. Take the needle. Easy. The other thing is we don't have nails like that when we're doing stuff. You can't have work like that.
Dad.
Pull. Good. Take the needle driver. Now pull more. Good. Got to give it, you only have a little bit left, so don't. Yep, good. Yep, perfect. Pull the needle. Nice. Gentle. Yep, do it again. Now we'll talk about it. I'm not going to get into it now, but sometimes I'll tighten it one way, and then when I flip it, I tighten the other way. Coming across one way, then I'll come back this way.
Well, not all of us are good like you.
Well, I've been doing it a long time. Sewing fingers on, freaking all kinds of things. Perfect. Yep.
Why'd it go like that?
Hmm?
Why is there a loop?
Oh.
I don't want to hurt you.
It doesn't hurt me. I have a high pain tolerance, believe me. Now see, you want to be underneath that, but that's okay, just do it. Yep. 1, yep, 2. Good.
Another one?
Yeah. Anyway, so this is it. Not a lot of talking in this video. And so you know what you're doing is you're grabbing.
I went too close.
Right. Just put your needle driver in there and pull that loop out of there. Don't do that. Like this. Hook it. Pull it out that way. Get it? Pull. There.
One more.
Yeah. Like I always say on DragBoss Garage, you never know what you're going to see or learn, and that's a fact. So pull them up, assistant. Yeah. Good. Now, no. That's a sharp. Take care of that. Put it on the needle driver. Yep. And then what I do is this. Sometimes, like if I do something, I put it like this. So it's down. See? Then you can't get caught. So let's get some new lap pads. We've got blood here. Clean up all that blood on the, just set that down. And then wash the hand off. Finger in the hand. So there you go. 22 minutes. If I was doing this, working, I could do this whole, I could have the patient seen, the note dictated, suture done and everything.
You don't gotta show off.
10 minutes, maybe less. It's not showing off.
There.
You said I'm showing off. Does that look 110%
Well,
to
I
you?
don't have any left.
Well, then you get it. We don't do that. Look at that's half-ass. We're not playing that game. You wash the whole hand. Usually the nurse does all this, so right now you're doing it all. But yeah, I'm fast at suture, and I can close that finger, that whole thing,
What?
4 minutes.
Okay.
A minute of
I
suture.
just did this.
Right. I'm just showing you. That's how, when you do it a million times, that's what happens. Come on, get all that out there. You might need some more.
Does it burn anymore?
No. Didn't burn that bad to begin with. Like this.
I don't want to
You don't want to what?
hurt you.
Hurt me.
Or pull your sutures out.
Well, if you didn't put them in good, they wouldn't pull out by just cleaning it off.
I think they're in good.
They're in good.
You're gonna need to wash your hands.
Yeah. I want the guys to see how good it looks that you do good work. Could use water on it, I guess, but I like alcohol.
Get dehydrated after doing so good.
Yeah. Some of this is bruised from banging it or something. All right, that's it.
Let me see it.
It's anatomical. You can't even see where you sutured it. Those come out in about 10 days.
So does that mean I did good?
Did a great job. Excellent work. Let's show the guys. All right, guys, so look at, here's her job right here. But you can see what it looks like. Not bad for the first time at 13 years old. You'll be an expert by the time you're done with PA school.
Now we need to clean up the area.
So there it is, guys. How to suture a finger 101.
Always seeing and learning something new at DBG.
There it is. Remember, DBGU and DMI. That's going to be big someday. So you just stay tuned and watch how it grows. Fucking did awesome.
I think I did okay.
You did awesome, girl.
You don't get blood all over me.
It ain't, it's dry. Whatever. You did very good. I'm proud of you.
Thank you.
You just got to get used to putting needles through people's skin and all that kind of thing, right?
I'm scared. Well, luckily it's not going in me, but like, I just feel the pain.
Well, you should. That's your dad. You're doing it too, right?
Okay, we need to clean up.
I could do it myself. It's just hard to get that. It's hard for me to wrap the needle with one hand. You know what I mean?
Yeah. Okay.
Oh, we're still recording, aren't we?
Okay.
Yeah.
These are going in the trash.